Honorable Minister of Health, Coordinating Minister for Human Development and Culture, Minister of Home Affairs, distinguished excellencies, participants, partners, ladies and gentlemen. It's a real pleasure to address you virtually today at this special TB Summit 2021 in Indonesia. This is a crucial time for the fight against TB. We are at a crossroads. Last week, WHO, at the launch of the 2021 Global TB Report that includes data from Indonesia, announced that for the first time in over a decade, there was an increase in tuberculosis death. Tuberculosis is the world's second top infectious killer after COVID-19, claiming close to 4,100 lives a day. Approximately 1.5 million people died from TB in 2020, including 214,000 among HIV-positive people. It almost doubled the number of those died from HIV/AIDS, and it's still leading killer of people with HIV and a major contributor of antimicrobial resistant related death. The burden of death, disease, and suffering in Indonesia remains huge as well. It is among the countries bearing the highest burden of TB, but making progress in tackling the disease, including during the COVID-19 crisis. We are very impressed by the leadership in the country, starting from the highest level with His Excellency President Joko Widodo. The Presidential Tuberculosis Elimination Initiative and upcoming decree are critical to enable and accelerate the multi-sectoral response by bringing all ministries and sectors together to end TB in the country. This is aligned with WHO's multi-sectoral accountability framework and has been showcased as a model for other countries to replicate and follow. We also commend the prioritization of essential TB services during the COVID-19 pandemic and the use of innovations such as the TB dashboard apps and other digital technologies. This TB summit that involves central and regional governments is an important step in taking forward the President's direction at the joint movements toward the elimination of TB 2030. I would like to raise a call for action on 4 fronts to ensure that the commitments made to EndTB are achieved. We urge you to implement 10 priority recommendations outlined in the 2020 progress report on TB issued by the United Nations Secretary General Antonio Guterres and developed with WHO support. These include activating high-level leadership and multi-sectoral action to urgently reduce TB death, increasing funding, advancing universal health coverage for TB prevention and care, addressing drug resistance, enhancing engagement of civil society, communities, and people affected by TB, promoting human rights, advancing technological breakthroughs, and rapid uptake of innovations, and ensuring essential TB services are safeguarded in the context of COVID-19 and other emerging threats. Essential TB services should be sustained during the COVID-19 pandemic to ensure that gains made to the fight against TB are not reversed. All measures should be taken to ensure continuity of the services of people who need preventive and curative treatment for TB, including during emergencies such as COVID-19 pandemic. People-centered delivery of TB prevention, diagnosis, treatment, and care services, including through digital technologies, should be ensured in tandem with the COVID-19 response. Tackling health inequities is vital to ensure health for all. The COVID-19 pandemic has drawn attention to the deep disparities that persist between and within countries, some of which are being exacerbated and risk widening even further. People with TB are among the most marginalized and vulnerable, facing barriers in accessing care. WHO is calling for global action to address health inequities for people with TB and other diseases. We need to double investments in the TB response and in TB research and innovations, as well as concerted actions across the health sector and others to address the social, environmental, and economic determinants of TB and its consequences. Everyone has a role to play in ending TB. Individuals, sectors of economics, communities, businesses, government. I urge you to work closely together to be the pathfinder and model for other countries, region, and world in accelerating the TB response, reaching the targets, and saving lives. We have just 400 days to go to reach the 2022 global TB targets and keep the promises made at the UN high-level meeting on TB. While we struggle to overcome the COVID-19 pandemic together, we should not neglect the millions of people suffering and dying from TB. Our success depends on you and your work on the ground. WHO will stand by every country, partner, society, or person that decides TB, COVID, or any disease has no place in its future. We are running out of time. The clock is ticking. It's time for urgent action to end TB. Thank you.